if you've self-prescribed Kegels exercises, or you've been prescribed them but the diagnosis is wrong, then Kegels exercises could be making your pelvic floor symptoms worse. So today I want to explain to you a little bit about why that would be and what your alternatives are, and a way that you can start to figure out if Kegels exercises are actually the right thing for you or not. Hi guys, my name is Luke and I am the lead practitioner at Men's Room Shockwave. We exist out of a clinic called Body Zest, which is in Banstead, Surrey, and we help a lot of people with a variety of men's health issues. We're in a multidisciplinary clinic, so we actually treat a lot of different things here, but Men's Room is specifically talking about men's health stuff, and today I want to talk to you about Kegels exercises. Now, Kegels exercises have really become the go-to in terms of male pelvic floor. You know, anyone that has got a suspected pelvic floor dysfunction, or they've got some urinary incontinence of some degree, or they've potentially got some erectile dysfunction, which someone believes is associated with a pudendal nerve issue, then pelvic floor exercises are the go-to, and Kegels seem to be the one that everyone is offered. Now, Kegels exercises have got good research behind them, and there's a lot of times when they are absolutely appropriate. But like in medicine, there is always a massive but to these things. And the but in this situation is, what's the diagnosis and what is the timeline for these exercises being given? Those two factors are massively important for any exercise to be prescribed, especially a strengthening exercise. So I'm going to explain why. So if we remove ourselves from men's health for a second and jump into musculoskeletal, I'm going to use this as an analogy to maybe try and help you understand. If you had a really tight, let's say, bicep, okay? Your bicep is feeling super, super tight. Maybe you've been doing a load of gardening. Maybe you've been doing some DIY at home. Something has led to this arm just essentially feeling like shit, okay? And you go and see someone and they say, yeah, I think what you need to do is you need to strengthen up your arm. Now, if you take that statement on its own, then it would be like, okay, if my arm was stronger, then maybe it would have coped better with the gardening, or it would have coped better with the DIY. So there's probably some truth in the statement. But right now, your problem is that your arm hurts. And is the solution to your problem, as you see it, which is the pain, is the solution to that to make it stronger? I would argue, no, it's not. I would say that the long-term solution to preventing it coming back again is to make your arm stronger. But right now, when your arm's in pain, what you actually need to do is reduce the tension and reduce the pain. Give that body an opportunity to heal, give you an opportunity to start to use it normally, and then progressively build up strength from there. Right, now, if we apply that example that we had for the arm, but to the pelvic floor, it's the same principle, okay? That if those muscles have tightened up in the pelvic floor and they're compressing the pudendal nerve, and it's then causing some urinary symptoms, or maybe some ED, or maybe some numbness on the penis itself, then the first thing we should be trying to do is release the nerve, release the muscle, and then build the strength up to stop it coming back again, okay? That is always the first port of call. Muscles are very reactive, okay? I see a lot of people with pelvic floor issues because they just started a new workout routine, or they just started running, or they just started cycling, there's compression into it, or they started a new job and they're sitting a lot. Changes can sometimes just make muscles tighten. We need to work out ways to loosen those muscles off and then strengthen them in the long term to prevent reoccurrence. If you jump straight into that strengthening process when those muscles are already really tight and you're saying, yeah, I'm going to get these muscles contracting, and they're already like that, it's pretty obvious what's going to happen. It makes people's symptoms worse. And then they're like, well, what am I doing here? You know, like I'm now feeling discomfort as I'm doing it, and my symptoms are literally getting worse, not better. Now, there is an argument in certain situations, okay? You know, in women's health after childbirth, and of course, you know, like just trying to loosen things off when there's a load of hormonal changes, it's a little bit different. So, you know, different conversation. speak to a different expert who's doing more in that field. In men's health, I'd say that a prostate removal is quite an interesting example too, because actually, yes, there's a nerve involvement there, but it's not a typical pelvic floor dysfunction, you know, it's much more to do with that nerve activation. And because, you know, any sort of trauma to the area, it is probably required for you to be engaging them more than loosening them, okay? But for your average guy who's not had surgery, nothing has massively changed medically, but you've just started to notice these symptoms come in, I believe that it's much more likely that you've got a reactive tightening that needs to be loosened, as opposed to just a weakness which needs to be strengthened. And you're way less likely to make your symptoms worse if you start with gentle exercises like stretches than you are if you go straight to more difficult and stressful exercises on the area like strengthening exercises. So in terms of actually how to strengthen off through the pelvic floor, I've got a few exercises that I've got in a little pack. So instead of me demoing them all, if you actually want them, then pop onto the website, drop us a message or just drop a comment or something like that saying pelvic floor, and we can give you a link to the pelvic floor exercise sheet, and that's going to give you all the things which we give to our patients to help them with their pelvic floor issues. And if you're in the Banstead, Surrey, South London area, you're someone that's struggling with this, we offer everyone a completely free call if they want to have a conversation about whether you're someone that we can help. We've got some really fantastic treatment options for things like this. We do shockwave therapy, which forces those muscles to relax and gets really good outcomes. We've got nerve stimulation, so we can actually drive that pudendal nerve function back up, and we can absolutely deal with a pelvic floor problem that's causing erectile dysfunction or urinary incontinence for men. So if that's something that you're struggling with, drop us a message completely privately or book a call using the link, and we're here to help.